Good afternoon, everyone. I'm Governor John Carney. Thank you for joining us again for our weekly press conference on Delaware's response to COVID-19. We've been doing this now for going on 7 months. It seems like a lot longer than that. One of the main functions of these press conferences is to keep everyone up to date on the situation in the ground in our state in terms of the number of positive cases, the testing that's happening across our state, the individuals with COVID-19 that have tested positive, that are hospitalized, sadly those who die. And I've been saying now for a couple of weeks, we were doing really good there, and we're steadily pushing our number of positive cases and percent positive down, and we were having a lot more people tested, which of course helps increase that denominator to determine your percentage. And as we move into the fall, we're starting to move a little bit in the other direction. Positive cases on a daily basis are up a little. Our target, if you remember, for quarantine in New Jersey, New York, and Connecticut was 97 new cases per day, and now on a 7-day moving average, we're just above 100 a little bit. We'll see that in a minute. And the percent positive has trended above 5%, which is the World Health Organization target, one that we talk about on a weekly basis. So we're trending a little bit above there. And really as we look at behind the numbers, we see a few things that Dr. Rattay and Schall, and I should have introduced them at the top. I'm joined again today by Dr. Karyl Rattay, is the Director of Division Health. She's back. It's nice to have you. It's also her birthday, so sing happy birthday to Dr. Rattay when you get a minute. And of course, Schall, the Director of the Delaware Emergency Management Agency, is with us as well. He's our testing czar, and we'll be talking a little bit about testing and trying to get our arms around making sure that more people get tested. So we look at these numbers each week to determine whether we're going in a positive direction, staying about the same, or maybe going in a little bit direction. And I've been saying for several weeks now that we're not as good as we want to be, we're not as healthy as we want to be, we don't have as little COVID-19 spread, community spread as we'd like to see, but we're not as bad as other states and not as bad as we've been. And so we're kind of in this uncomfortable middle zone. Our objectives, as I've said time and time again, are number one, to get our children, our young children, back in school and in front of teachers for in-person instruction. We do have that going on in some districts in our state, mostly downstate. I visited Woodbridge High School at the end of last week and talked to teachers and staff and saw the accommodations that they were making. What I've heard from all of the above was that it has been a very positive week. That was their first week. The students that were in school, the teachers that were teaching, were all happy to be there, very cautious about and taking the necessary precautions. But one of the good things that I heard was that the students were all wearing masks, came to school with masks. It was something that we were concerned about. Might not happen, but it turns out the students, at least there at Woodbridge High School, were doing a good job with it. We also visited a little daycare down there, Little Sprouts in Seaford, and interestingly, those teachers there have an important role in the education of the school-age children who are there while their parents are away in districts where they might not be going to school in person on a given day, and so their staff takes over for getting them loaded up on their the tech equipment, on their laptops or notebooks mostly, I guess. We've talked about connectivity with respect to the internet and some of the challenges some of those Western Sussex school districts have. Fortunately, we have funded infrastructure improvements down there, which are underway. I know the districts are experiencing some backlogs in the ordering of equipment. So we're moving along there, getting some good experience from those school districts that are in a hybrid model, some students in the classroom, some with remote learning. A challenge for teachers for sure, but they're doing a really good job adapting, and I know it's been stressful for them, again, talking to them as I have this week. But we'll continue to try to support the districts and teachers and classrooms and try to continue to get more students in those classrooms. What we're hearing from parents is more and more see schools that are going in person and would like to see their children there as well. It does present challenges for some school districts, and that's why I think one of the better decisions that we made was to allow that to be a decision made at the local level, the local school district level, so that they can make the appropriate accommodations that their buildings and student populations and the desires of their parents for their children. So we need to get better. We're really looking at, again, as I talked about last week, we've got a good partnership, AJ, with University of Delaware and with the Newark Police in terms of off-campus social activities, breaking up big parties. Similarly with Delaware State University, we have seen some higher cases at the University of Delaware. A little better situation at Delaware State. They've been doing significant testing down there as well, as has the University of Delaware. We're trying to get all that coordinated with our testing at the public health lab. But again, a lot of activity there and the potential for outbreaks, much like what has happened in college towns across America so far. We feel pretty good about it. I've been very concerned about the effects of a beautiful Labor Day weekend on driving positive cases up. We haven't seen that yet. It could be behind some of these little upticks in Newark and in Wilmington, but certainly not what it could have been. So this week we have gotten some feedback from local community organizers about what we call pop-up testing sites. We've gone to some fixed sites through Walgreens and that partnership and other high-volume sites, but we realize that we need to get certain communities, and we will continue to do that. AJ is going to talk about that, and we'll have a list of those sites, which include Eastside Charter School in particular, Kingswood, 3 times at Kingswood, Surratt Park in Newcastle, Judy Johnson Park on the west side of Wilmington. I mentioned Eastside Charter, Seeds of Greatness Church, again in Newcastle, and of course the LACC, which has an arrangement with Christiana Care. And the Rite Aid, I guess, on North Market Street is also a test site that's a little bit separate from ours. So we're working hard, both in the Division of Public Health. Dr. Rattay, your staff has been doing a really amazing job, and we appreciate their efforts. And of course, our first responders, likewise, AJ. And I think our testing operation is a model with really some significant innovations there that I think you're going to talk about with respect to test at home, which I think will be really good for everyone, but particularly for our vulnerable populations, those folks 65 and older. So let's take a look at the data dashboard. We're closing in on 20,000 total cases since the first case back in early March. Sadly, another couple lives lost, 628. Again, most of those in well over 500 in the vulnerable 65 and older population, many of which with pre-existing health conditions. Hospitalizations are bouncing around a little bit, kind of leveling out there at the 60 level with 62 current. We were on the call the other day with the hospitals, and they're obviously concerned with what they see. And this is something that I should point out. Those of you who need hospital care, you should go to the hospital. They are, what the hospital folks are telling me is that the acuity, the seriousness of the illness or condition that people have put off because they're a little bit hesitant to go to the hospital is rising, and that's a bad thing. If you need to be treated at the hospital, you need to go. They take all the precautions with respect to personal protective gear and are certainly prepared to prevent the spread of the virus. But so if you've got a serious condition or ailment that you're just putting it off, make sure you take care of yourself if you need hospitalization. So here's what I've been talking about. That 6.7% positive is above our goal of 5% positive. Obviously, the gating criteria for the schools is 3%. And that's both a function of additional cases. You can see 103. The gating for the quarantines was 97, so we're up above that by not quite 10 cases, just a little over a half dozen cases. We want that, though, to be going south of 90 and below. And so with the little bit of uptick there and the little bit of a decrease in the number of people testing, and that's a challenge that we're facing that we need to try to address. You see, you push your percent positives up to just over 6.5%. So we want to move both of these numbers down, and we're going to do that by testing more and being more thoughtful. We need more productivity, meaning more tests done at each of the testing sites. And we need more people in the public to get tested. Remember, the tests are free. You don't have to be symptomatic. It's really easy to get up and get through in a short period of time, and you get the results mostly by email, AJ. And of course, if you do the test at home, it's a whole new thing that AJ will describe to you. You don't have to go out to a testing site. But these are our two really things that we need to focus on, and we on the public health side are trying to figure out, okay, where are these little outbreaks across our state? We just see generally higher percent positives and higher number of cases in certain geographic areas, but not necessarily tied to a particular event. Obviously, the Newark cases are a little bit tied to the return to school of the students there, but not much that we can pin the rest of it on. So we're closing in on 10,000 positive cases in Newcastle County, again, 2,800 in Kent County, and as a percentage of the population down there, Sussex County still has the highest rate of infection, and of course that goes back to our experience with poultry workers back in April and early this. Here's the rate of positive cases per 10,000 in the population by age group, so this is a rate. And again, you can see that young adult population, 18 to 34, continues to separate itself as with the highest rate of positive cases. Again, associated with beach and bar and restaurant activity, the return to campus, and off-campus parties, and just a lack of a little bit of complacency and not enough attention to mask wearing and keeping away from large gatherings. Here's the 14-day view on hospitalizations. As I said, we're pretty flat. New hospitalizations on a day-to-day basis are down a little bit, but the percent positive here on the 14-day view is flat, but that's flat above 5%. We want it to be declining below 5%, and new positive cases, that you can see the little bit of irregularity there. That is in part some of the testing that's done at the University of Delaware that comes into our dashboard in stages, if that's the right term. And so it shows a little lumpy. The bars are a better measure there in terms of the 7-day moving average. But again, above where we want it to be, and we want it to be going down, not staying static or certainly not going up. So if you look at the 90-day view, you can see the little bit of an uptick of late at the end of August, early September, in terms of, after the real trough there during the summer, and just not where we want to be today. Not overly concerning, but certainly when your objective is to get children in schools and get people back to work, those are important measures of the health of the community. Personal protective equipment, AJ, continues to be with all the beakers full. Here's the school opening criteria. Again, we're furthest away under new cases per 10,000. That number should be 10 to get us into a green scenario. Percent positive needs to be at 3. This is a little bit, you can see this a little bit different time frame here, and so the 7% is higher than where we are today. We've trended down a little bit on this one. And then, of course, daily hospitalizations, we're still below that. So we're solidly in the yellow category, which indicates a minimum to moderate community spread pretty well explains, Dr. Rattay, where we are. And we'd like to be in minimal community spread, again, to have a safe and healthy condition for students to return to classrooms. We talk at the front, you should have seen this little advertisement for the COVID Alert DE app. It really is a neat little tool to help you know whether you've been exposed to somebody who tests positive. It's completely anonymous. They don't know who you are, and they don't use, they use, I guess, Bluetooth functions in your iPhone to determine whether you've been close to someone else who's opted in, who's recently tested positive and has alerted the Division of Public Health as much, and turns on the app to alert anybody who may have come in contact with that phone within a certain period of time, I guess a 14-day period, within 6 feet for more than 15 minutes. So that's the metric there. So nice tool to be able to help you to know whether you're at risk, whether you should get tested. You should get tested anyway, but if you sign up for this voluntarily, anonymously, you'll get an alert when you've come in contact with somebody that might put you at risk. Just a couple reminders before I turn it over to Dr. Rattay. We're coming to the end of the month of September. We need everybody to complete your census by September 30th. You can go online, as you can see here, to my2020census.gov. That's my2020census.gov. Please go and complete your census so that the state of Delaware can get as many people as live here registered, and we can get the resources that we need, mostly that come from the federal government based on the population of our state. And so this is a really important function. Our Lieutenant Governor has been doing a great job encouraging folks and doing the outreach to get that done. And then we've talked a lot on this because of the pandemic public health risk of voting, to encourage as many people as would feel safe to vote by mail and to do that as quickly as possible. And you have a deadline to register, which is Saturday, October the 10th. So make sure that you're registered and make sure that you're signed up to vote by mail. We had overwhelming participation in the primary of a week ago. A lot of it, I think, was due to the fact that roughly half of the voters in both parties voted remotely by mail. It's easy. You don't have to worry about waiting at a poll and possibly being exposed to somebody with COVID-19. So take advantage of that opportunity. Dr. Rattay, thank you for the great work that your team is doing, and happy birthday.
Thank you so much, Governor. I just have to say that I think the highlight of my birthday is that I got a birthday song from the governor.
Oh my gosh, that's a pretty boring day, I would say.
So I want to talk a little bit about what we're seeing in the data. As Governor Carney just said, we really want to push our numbers down. We want to push them down as much as we possibly can. When we look overall in Delaware, as you saw, we are seeing some increases in cases and percent positives. When we look at certain geographic areas, we're seeing higher increases in comparison to other areas. We've talked a lot about Newark and are really grateful for the partnership with UD and the city of Newark and the comprehensive approach being taken there to address an outbreak really related to University of Delaware. But we're also seeing in the data some increases in Wilmington as well as Bridgeville. In the Wilmington area, there's several zip codes that jump out, 19802, 19805, and then also neighboring Newcastle, 19720, just seeing slight elevations there. And then downstate in western Sussex, Bridgeville, Seaford, Greenwood, and Laurel as well, we've seen some increases. So I mentioned these areas a couple weeks ago. We're keeping an eye on them. On the next slide, I I just wanted to remind folks how we respond. I think you've seen it when we responded to the poultry plant issue, in our response to the beach issue. We've talked a little bit about it with our University of Delaware response in supporting that outbreak. But we take a comprehensive approach to responding to increases, making sure that we're testing as many people as possible to identify people and then get them isolated and separated from others so we can stop the spread. Education to make sure that the important things like face coverings and social distancing are that people are certainly aware of what they need to do and able to do it. We also look at what are enforcement opportunities. You've seen that with the beach bars. You've seen Newark with the way that gathering limits have been implemented. So enforcement is a really important tool. And also, our surveillance is really important, and we've really been able through this pandemic to really increase the data that is giving us the information we need to better understand what's happening in the communities, and that includes through the case investigations we do. One of the reasons why it's so important that somebody who tests positive talks to our case investigator and gives the information that is needed, because it not only helps that person so they can be safe, it protects their family members and their friends, but it also helps us to better understand how things are being spread in the community. One more mention I want to make on testing before we move off this page is the new testing plan that you've been hearing about a bit has been about really increasing access, convenience for people so that they can get a test when and where they need it. And one of the important factors of this testing plan that we've talked about is that when we do see elevations in a community, it helps us respond. We're now better able to respond to testing when we see increases in communities. So let's talk a little bit about, on the next slide, 19805. I just wanted to hone in on the zip code a little. So if you go to the next slide, you can see that we've seen some slight increases in percent positive cases and new cases in 19805. It's not alarming, but you see the trend going upwards. And you also see, when you look at percent positive in comparison to what we're seeing in the state, you see that this zip code is higher than the rest of the state. And so previously, we might not have responded to a community where we're seeing slight increases, but for us now, we think where we are, we really want to respond and really lean into communities where we're starting to see increases to get things turned around sooner. In 19805, there were 84 cases in the last 2 weeks. The average percent positive is 9%. So again, you can see that it's a little higher than the state average. But also, as I was saying, how important it is for us to get as much information as possible. When our case investigators talk to positive cases and look at the data, what they're finding is there's not one particular event or activity or location that people have gone to. A lot of the spread seems to be happening in homes. We've seen a lot of people who are positive cases in the same address, and that really helps us to target how we do our outreach and education in partnership with community members. So on the next slide, testing. Again, our new plan really is focused on testing for everybody across the state, but when we see increases, we really want to lean into those communities. So just in 19805, we have a new Walgreens that opened last week, popular place. We had 430 tests in the first week. We also now have the Porter State Service Center, which is doing testing. LACC and Westside Family Healthcare for their patients have been doing testing for quite some time. But again, you'll see us doing pop-up testing, and AJ is going to talk more about that when we're really leaning into a community. Also education and outreach, and it's so important that we're working with partners and members of the community with our education. Through Healthy Communities Delaware, we have COVID coordinators who are from the community and really on the ground, as well as we have field contact tracing teams, but we're also working with partners on other approaches to really get some on-the-ground education in the Wilmington area around things like face coverings and physical distancing, which we know are so important, but also making sure people know, who should get tested and where they should get tested, and also making sure that, especially since we're seeing spread in households, that people who have a positive test result, that they can safely isolate, and that their contacts know how to quarantine, that they know what that means. And big part of that is making sure that they've got the things they need. So we're using the care kits. You heard us talk about those with a poultry plant response, making sure that everybody has face coverings and hand sanitizer and soap, the things that help protect one another in a household setting. So we're going to continue to have discussions with our key partners. AJ and I are excited to meet with the Lieutenant Governor and a group of faith-based leaders on Thursday to present a plan, a proposal with them and get their thoughts. We really want the faith-based leaders, churches in our state, to be able to do their own testing. So we want to be able to provide that support. So more to come on that. And we also are want to make sure that employers and employees know how often they should be tested and how to get tested. So we want to remind people to go to the coronavirus.delaware.gov/reopening to get more information about who should get tested, how often, and of course, where to get tested. Just a quick reminder about the flu shots. Flu is something that we're all over this year. We have got to make sure that as many of us get vaccinated as possibly we can. It's so important that we protect or prevent influenza this year. Although the flu vaccine won't prevent us from getting COVID, it will prevent illness, which is really important. Every year, influenza stresses our healthcare system. It maxes out our capacity in our hospitals. And if we have COVID and flu at the same time, that's going to be putting an exceptional strain on the healthcare system. So we recommend vaccination for everyone ages 6 months and up, especially higher risk populations. Really important that you get your vaccine, and it is available all over Delaware now, pharmacies, supermarkets, primary care. So go to flu.delaware.gov to find out where is the best place for you to get your flu shot. And finally, we can't let our guard down. We just can't let our guard down. As we are seeing our cases increase, these 4 important approaches: staying home if you are at all ill until you know if you're positive or not, or if you know if it's an illness. Keeping your hands clean, very important. But also, these face coverings, they work. And we know people are tired of it, but it's important that when we're around anyone else within 6 feet especially, make sure that you are wearing a face covering. And with that, I'm going to hand it back to the governor.
Yeah, thank you very much, Dr. Rattay. Some really important information there, important for all of us to know. And that last point in particular was critical for all of us to get your flu shot, to understand the increase in hospitalizations that happen at this time of year normally because of the onset of the flu. And you complicate that with COVID-19 and potentially a serious situation. My concern from the very beginning, back in early March, was that we would somehow run through our hospital capacity. By the way, the hospitals have been great partners through all of this. I mentioned early on that if you have a condition that requires hospital care, make sure you get down to the nearest hospital, because the acuity that they're seeing now, the seriousness of illness, is really getting concerning. But we don't also, as the flu arrives, we don't want to see a surge in hospitalizations with the COVID-19 as well. You mentioned some of the outbreak areas, City of Wilmington 19802, that's my home territory. We need to step up to the plate, 19802ers, and make sure we're wearing our mask. I noticed a little bit of complacency there compared to a couple months ago. So let's put our masks on and really fight this thing in Wilmington and in my home turf there at 19802. AJ.
Thank you, sir. So talk about a little bit more about testing today. I think Dr. Rattay did a good job kind of understanding how we're reactive to it. And I think I'm going to talk a little bit about that today as well. You know, testing is not just something the state's doing. We have a lot of partners across the healthcare industry, clinics, doctors' offices. The hospitals have been great since the beginning to help us get this capacity up and running. University of Delaware is doing almost 1,000 plus a week, so it's a lot of players in there. And I think if you go to the de.gov/get-tested, you're going to see a lot of options for testing. And our job is to try to make sure that they're convenient and they're effective and they're where and when people need them. So if you look at the the three areas, I look at this almost like the three-legged stool. We have three parts of the testing program that the state runs, and they all have to work together in order for us to have an effective testing program. So last week we announced the permanent testing locations. That's 19 locations to include Walgreens service centers and the public health clinics. They are open Monday through Friday. They provide the longer hours and kind of that convenience for some of the people. We have the pop-up community testing event. So we were doing approximately 14 to 16 or 18 on some weeks. Before we scaled that back a little bit because we've used some of that staff to go into these permanent locations. We're committed to do 8 to 10 pop-up sites a week going forward. There's going to be shifting here as well as we respond to the data in these bubbles that Dr. Rattay sees as we get ready to bring hopefully another several school districts back into the classroom in a hybrid fashion over the next 3 to 6 weeks. We want to make sure we're able to provide some testing prior to when they get there. Again, all the is listed at the delaware.gov/get-tested, and we'll talk about that more. And then kind of the last leg on the stool is one of convenience, and that's something I think we really want to emphasize, and that's the at-home testing kits. We launched this with the school teachers last month and the faculty and staff through all the districts and the schools to be able to get tested prior to going back to school. It worked well. We decided to roll it out for Delaware residents, and at this time, you must be a Delaware resident. We want to stress because of the convenience, if you're 60 years of older and you don't want to go stand in a line at Walgreens, join the community sites up, you could go online, you could register this. The only thing you need is either a smartphone or a tablet, and then an email address, because that's how you register. Kits gets UPS to you overnight. You do it with a medical provider over a Zoom session, drop it back in a UPS box somewhere, and then they get the results to you in 48 to 72 hours. We have capacity here, and it's something we want to make sure people take advantage of at this time. That's de.gov/home test. So again, we got the fit sites, the home options, and these pop-up mobile sites. Yesterday, we had a great meeting with leaders in the greater Wilmington and Newcastle area to talk about getting some of their feedback. And like I said, we want to make sure we're effective. We want to make sure we're getting the message out. We do a lot of email blasts. We put it on social media. We have the Get Tested website, but there's community partners out there that just help us really emphasize and broadcast that even more. So we can't do it without them, and we appreciate their partnership and information they give us. So this week, testing locations in Newcastle County. Again, I've mentioned how we have a lot of players here. We have Kingswood Community Center, which was today. We have the LECC that is Wednesday, Friday, and I believe it was yesterday as well. They are by appointment only, and they are on there. And then we have the curative ones. So the curative ones are the walk-ups, drive-through. And today we were down at the beach again. Wanted to do that 2-week kind of post-Labor Day check-in down there at the beach. We're at Threat Park in Newcastle. Tomorrow is going to be Eastside Charter from 2:30 to 6. And then Thursday we'll be Judy Johnson Park, and Friday is going to be Seeds of Greatness Church from 2 to 7 as well. Just a quick note on the curative site that everybody's probably become used to now over the last several months. Curative is going to be doing a little bit different landing page for their registrations. You'll be redirected to automatically. You'll be able to select Delaware and find out what we have scheduled. So if you see something changing there, it is known, and we'll also do some outreach about that once we get the specifics of the launch. Kent County, today we are, like I said, we're down at the beach. Tomorrow and Wednesday, Georgetown and Dover. So again, making sure we have ample and multiple avenues for people to get tested, whether it's a pop-up site, the at-home test, or through our medical providers that are out there in the clinics and the Walgreens and the State Service Center. So gettested.gov has a lot of information, and it's probably your best place to go, but we'll continue to update this and keep everybody up to date, sir.
Very good, AJ. It should also be recognized, the partnership that you have started with the Newark City Police Department and the University of Delaware Police with respect to enforcement there of the town ordinances in terms of off-campus gatherings, and making sure that that message is delivered and received so that we can prevent the spread at the University of Delaware and in the Newark community. I know residents, talking to the mayor today, residents are very concerned about that, and we're committed to getting our arms around that early. So some really important top line messages today. One is get tested, get tested, get tested. Really need to push up the testing denominator number. We've got lots of opportunities there, including the community pop-up testing in several sites in the city of Wilmington, including Eastside Charter. We've got the test at home, which is de.gov/home test, really a great option, particularly for seniors and those who can't get out to the testing sites or were concerned about it. Again, sign up for COVID Alert app. It's another tool to help you know when you've been potentially exposed and you can get tested. Flu shots, incredibly important now as we move in to the fall. I think the first day of fall is today, and the return of the flu is right around the corner. And those of you who are putting off hospital care, don't do that. Take care of yourself. If you need to have a procedure done, make sure you get it scheduled up. We're seeing an increase in acuity at the hospital, and that's not a good thing for the health of Delawareans. Our goals remain the same: to push down the spread of COVID-19 in Delaware, to get children back in the classrooms and people back to work, and we'll continue on that. We need your help. Wearing masks is the most important thing that you can do in public. Avoid large gatherings, keep your social distancing, take care of your elderly parents and grandparents, and get tested so that we know where the virus is present in our communities. So with that, I think we have some media in the room, and we also have some pre-submitted questions that we're prepared to answer. And if Sarah has a question, we'll hold the microphone. I'm stringing it out a little bit as you get prepared for your questions. Thanks, though, for joining us and representing the Delaware Online.
How are you, Governor?
Good, thanks.
So, nationally, there's been a discussion about the vaccine and how it's going to be distributed. Does Delaware have a plan yet on how it's going to distribute the vaccine? And if so, what will that look like?
Yeah, so I'm going to turn it over to Dr. Rattay, but I will say this. On our White House call yesterday, that was subject number one, and there were kind of two pieces to it from the public health professionals there at CDC and NIH, Dr. Fauci in particular. One is, if we have a vaccine and when we have a vaccine, it'll be safe. There's a lot going around the internet and whatnot that vaccines are not safe, and he went through all the procedures that a vaccine has to go through to get approved by the FDA. So number one, that it's safe, and number two, that there are appropriate protocols, and those protocols are known by Dr. Rattay in the Division of Public Health, and that's something that we'll have to address when the time comes. Dr. Rattay.
Yeah, it's a great question, and our team has been working on this for months already. Working with limited information, which little by little we get more information about what to expect. For example, one particular vaccine has to be stored at a very, very low temperature, negative 80 degrees. So, as we learn more, we start, from a logistics perspective, we start incorporating more detail into our plans. But we have much of our plan completed, at least as it relates to what information we have now. Now, last week, CDC did provide a little bit of additional information to the states around what they'd like to see in our plan, and we have 30 days to officially submit our plan. We have no concerns about our ability to get that done. I will point out one of the things, and we saw this with H1N1, with the swine flu in 2009, which was, I think, one of our greatest challenges is you have to prioritize when you get vaccine. We're not going to get enough vaccine to vaccinate every Delawarean that wants a vaccine early on. The National Academy of Sciences recently put out guidance around prioritization, but this is an important, this is really important that we get this as right as possible, because it is going to be pretty limited amounts of vaccine that get to our state to start with. So we want to make sure that we're focusing that on the highest risk healthcare providers, as an example, as a starting point, or the highest risk Delawareans. But eventually, we'll have adequate vaccine, and we call this phase 2 of our plan. We'll have adequate vaccine for every Delawarean. And so that's a whole different approach to vaccination, and all of that will evolve in the upcoming, next 6 to 9 months or so.
Yeah, I'm imagining, correct me if I'm wrong, but I'm imagining the populations that are going to get it first are the ones who have already been kind of prioritized throughout this process regarding testing, et cetera.
Yes, it's always important that you vaccinate your frontline healthcare workers and first responders as early as you can, because we have to keep them safe and functioning, but also highest risk individuals, so those over age 65, vulnerable populations in long-term care facilities are going to be really important to get the vaccine to as soon as possible.
Okay, so one more question. This is coming from our education reporter. New York Times report on how states are handling coronavirus in schools reported that Delaware is planning to publicly report coronavirus cases in schools. What are those plans specifically?
Yeah, we have talked about that. We know that there will be and have been already cases associated with schools, not transmission within a school, which is a good thing. It's still early, just a handful of districts that are in person, but we're trying to figure out ways to make that available, and have already addressed the reporting requirement there.
Yeah, exactly, Governor. I mean, it is important to us to be as transparent as we can be, and so we're working on what's the best way to get up onto our website the best information. As you know, the governor is requiring the schools to report when there are positive cases or an individual who may have been contagious in their facilities. That's the exact information that we want to capture, across our schools, how many individuals may have been contagious within the facilities. So we will be, I don't have an exact date, but we are working on getting that up so that we're updating that on a regular basis.
Do you mind if I piggyback a question on that? Have there been any reported coronavirus cases among teachers and or students in the schools that are open, the public schools that are open so far?
Yeah, it's a great question. We have, these are cases where we get an epidemiologist does an in-depth, interview to try to understand this on every case. We have no known cases where there has been spread within the school facilities at this point in time. But of course, that is something that we're going to keep a close eye on as we move forward.
Thank you so much.
Yeah, I would just make one comment, and again, it's just one school, but I was very impressed with what I saw at Woodbridge High School in terms of the protective measures. They obviously worked with a liaison from the Division of Public Health. And one of the feedback that I did get that was encouraging as well is that the students seemed totally on board with mask wearing. It was not a problem. Everybody expected it to be, which was good news. Haley.
All right, first question's from Madeline Overturf at WRDE. The town of Delmar has announced its plan to observe Halloween festivities like trick-or-treating. With rising COVID-19 numbers, what do you think about this? We also had a similar question from Amy Cherry at WDEL. Last week, the state said it planned to issue guidelines for safely enjoying Halloween. Has that changed now that CDC has recommended trick-or-treating be avoided?
Yeah, I thought there was interest in our recommendations with respect to schools, but there's been nothing like Halloween so far in terms of the interest, and obviously it's a great holiday for the children and families, and with COVID-19, it's kind of appropriate. Everybody will be wearing masks. We would like to come up with guidelines, as I said last week, to enable Halloween to be had safely, and public health is still working on it. What's the date? September 22nd. We want to get this out as soon as possible, but it's something that we will get out in time for folks to adjust to the season.
The next question's from Betsy Price at Delaware Live. With the success of a higher turnout in the primary, will the governor and the state support voting by mail permanently?
Yeah, I certainly would. I mean, I was really blown away, to be honest with you, when I saw the numbers. Well over, I want to say 70,000 combined Democrat Republican at 6 o'clock. I don't remember what the final numbers were. I think on the day, the combined numbers of remote or vote by mail and in person was like 150,000. Over 30%, which is as high a turnout in a primary that I can remember. That's a good thing. I mean, my view is, and I think the view of my party is that we want to make it possible for as many people to vote and vote safely as possible and vote securely, and vote by mail, frankly, does it more, as I said, and it's a really safe way for voting to occur for anybody that's elderly and could be vulnerable. There were lines at my polling place as I went with my wife, and we voted in person. And so it's not the kind of thing that you really want somebody that's in a vulnerable population to do, so they can vote comfortably from home. The legislation that passed that enabled vote by mail was passed by the legislature. It's not something that I can do or intend to do by executive order under state of emergency. That just wouldn't be a good thing. So they'd have to do it. So the bill that they did pass only applies to the primary we just had and the general election coming up. And the legislature would have to come back in and pass that legislation. I think they should. I would certainly sign it.
The next question's from Susan Canfora at Coastal Point. President Trump recently characterized the shooting of MSNBC anchor Ali Velshi with a rubber bullet as a beautiful thing. Would you care to comment on what President Trump said?
It sounds like a terrible thing to me. It's not a very terrible thing to say, and it's a shame that it was said. I heard a similar comment by the president as it related to the COVID-19 the weekend, the Monday after the demonstrations, that some of which got out of hand a couple months ago, and he got on the line with, I think, 46 governors and said that he was going to send the U.S. military out to states if they didn't dominate the streets, to use his terminology, and that he would send them with real bullets, not silver bullets or rubber bullets. So it's just a strange and awful thing to say about a reporter.
The next question's from Amy Cherry at WDEL. How many people have downloaded the new COVID Alert DE app so far?
Yeah, so She must not have downloaded it herself because you can tell on your little phone. I think it's 25,000 and counting. I think we had 100 or more sign up as we've been sitting up here. There was a little flyer there that was on in the material that we presented. And I would encourage everybody to download it and participate. It's just a really good tool, anonymously done, that enables you to know of a risk of exposure that you may have had with somebody who's tested positive. Completely anonymous, completely voluntary. You can sign up and then not trigger it if you test positive because you get uncomfortable for some reason. But certainly you're in lots of situations where you come in contact with people and you might want to know, and it's not foolproof because not everybody's going to download it. We have 25,000 now. Other countries around the world have had as much as 30 or 40% of their population download it. That's much more effective. But I would encourage as many Delawareans as possible to download it. We understand that other states around us are taking a look at it, so that would add to the functionality of it, and really good tool.
This is the last pre-submitted question, then we just have one more question from Sean Green at WDEL. You've been continuously talking about schools needing the state to get to the green phase before they can fully reopen. Yet districts like Red Clay and Brandywine have said they're struggling to implement a hybrid model that matches requests for in-person learning. There's no social distancing requirement changes between the yellow and green phases. Do you see this being a problem when we eventually get to that 3% mode that triggers the green phase?
Yeah, first of all, I can't wait to get to that, to have that challenge and that problem, to get the full green scenario where we're bringing more children back to school. It will be a challenge because it does create logistical problems with spacing of students in schools. I did hear from Red Clay about the challenge they have with one particular school where a large percentage of the parents wanted their children in classrooms. I think it was 70%, and they just didn't have the space to accommodate 70%, which is, from my perspective, a problem and a challenge, but a good problem to have. One, the parents want their children in school. Two, the district is trying to find ways to accommodate it, and it's just one of those many challenges that we've forced to deal with over the last 7 months. I think what we're seeing there as well is more and more parents are seeing schools open with children in classrooms and doing it safely, and that's the key. Safely for children and teachers and staff, and wanting their children to be there as well, because it's a much richer educational environment. We all know that. I talked to teachers on the phone the other day. It's a lot of stress involved in all of this, and we're seeing that on both sides, students and teachers. They're much more comfortable under normal circumstances in classrooms with teachers. The teachers that I talked to at Woodbridge High School, again, were very excited about being there with their children, their students, and likewise the students. It just feels like more normal life, even though it is different because of the distancing and the mask wearing. Another question?
Yes, Governor, thank you for your time today. My name is Yesenia Taveras. I'm here with Saquon Simpson, and we're representing WITN 22, City of Wilmington's government TV station. The one question I have for you is more along the lines with what is the state doing with working with the school districts, with the parents who have children with underlying health issues such as asthma, hypoglycemia, diabetes, and since the encouragement here is to get all the students back into the schools, for example, let's say if we have a parent with 2 children where one child is healthier than the other child, and now that both of them have to go to school. Are we encouraging the parents of children with underlying health issues to go ahead and request a 504 plan, for example? So what is the state doing to work with parents with children who are more at risk?
There are 2 sides to that question. One is a public health question, and I'll defer to Dr. Rattay for a minute on that in terms of what we're advising the districts, and one's an educational question, and we don't have that expertise here, although I will answer it as I understand it, and that is there are real concerns, both the scenario that you just described, where students who are in school have parents who have vulnerable conditions, mostly with pre-existing health conditions. It's also the case that there are teachers that have pre-existing health conditions that need to. And so the districts are very conscious of those challenges and are making every effort to protect the teachers or staff that may have a pre-existing condition and say, I can't be in a classroom. And so most districts now are fully remote. They're doing the remote instruction. So they've been assigned to do the remote part of instruction. On the student side, I think similar arrangements are being made. I don't know as much about that, but Dr. Rattay might be able to shed some light on what the advice of public health is. I think mostly it is protect those vulnerable populations.
Thank you.
Yeah, I mean, when we think about the health of kids, we also recognize how important learning is for good health. And we, and I would say the American Academy of Pediatrics as well has been, strongly promoting to get as many kids back into face-to-face learning as is safely possible. But there's no one-size-fits-all. So for every decision, every situation, whether it's a parent or other family member or a child student themselves, a mild, moderate asthma case would be treated very differently than somebody with, significant heart disease, somebody who's immunocompromised from cancer. So it's really important to talk to an individual's healthcare providers to get, a recommendation as far as what's safest. But again, if people are wearing the face coverings and social distancing, we know that can prevent most all infection.
And one other thing that I would say, and this is, I think, true in all the instances that we've been dealing with, whether it's, bars, restaurants, schools, retail establishments, universities, the problem gets to be not so much in the structured environment, i.e. the school building, or the university classroom, or the bar restaurant setup. It tends to be those unstructured situations outside of the schoolroom, whether it's staff interacting similarly with staff in nursing homes, whether it's students who are partying in off-campus, housing, that kind of thing. Same thing we saw at the beaches. And so our messaging has to be broad in the sense that it's not just when you're in that structured environment, it's also your normal interactions. In fact, it's mostly your normal interactions. So that's when people leave drop their guard down and they take their mask off, or they forget about not being 6 feet separate from folks. When they're in structured environments, it's a little bit easier to control. One of our questions that we ask when we come up with restrictions for these business sectors, are we creating, will we have an unintended consequence? Like the university students, we shut down the bars and restaurants, we shut down the campus, and then they go into the basements in the off-campus housing that they live in. We don't want, that's a much riskier situation. So the districts, it's also why, to your point, on your question, it's also why I think the decision to allow the local districts to make decisions based on the conditions in their district, the number of students, the number of buildings, the configuration of the buildings, the staff that might be compromised, the students that might have challenges getting back and forth to school, all of that comes in. One governor at the state level or secretary of education can't make that decision for everybody. We set the guidelines, public health, and the districts through their administrative staff, teachers, parents, students, board members come up with those decisions locally.
Okay, wonderful. And if I may, just one more, do we have time for one more?
Sure.
For the zip code that you mentioned earlier that kind of seen a slight uptick, what do you think we can do to kind of bring that back down? I know we already have so many things that are in place, but what do you think we might be missing there, especially in your hometown there?
Yeah, I think it's complacency. I live in the city, I circulate around different neighborhoods outside of 19802. I'd shoot down Washington Street all the way through. I'll give you a perfect example, West Center City. I go down there to get on and off the freeway, and there's a convenience store at 7th and Washington. And for a lot of times I would see folks and they'd have masks on. More recently, as I've driven by there, not a lot of mask wearing. Just people letting their guard down a little bit. And a lot of interaction with folks there. Same thing in parks. I see some of the kids out getting ready to do their sports, and and they're not really social distancing with the masks on. And again, it's not as much a concern for the children as it is for their parents or their grandparents, right? They might be living with. I think it's little things like that, and it's behavior that that's really kind of inappropriate when there's such risk for a spread of a disease among, say, young adults that are, partying and you start to infect somebody, and that person goes home and infects somebody else, and then all of a sudden you've got somebody who works in a nursing home that gets infected. You know what I mean? That's the way it spreads. So we're trying to push all of that down. We don't have one thing to point to. We were worried about Labor Day and the effect of that. Haven't quite seen anything really specific there. We're worried about the big rodeo that happened down there in Bridgeville. Haven't quite seen anything there. We're worried about the University of Delaware, Delaware State. They've had some upticks, but not like other places. If we could just push it down everywhere and everybody be just a little bit more vigilant and get tested. And did I say get tested? And by the way, get tested and wear a mask. Just these relatively simple things that just people get complacent about, I think. That's my view. Dr. Rattay.
Completely agree. Thank
On
you,
her
Governor.
birthday.
Thank you so much.
29 years young. So that's it for questions. Again, for everybody who joined us today, just the top line messages: get tested, get tested, get tested. Look at the at-home test where you can sign up for it online and get it sent to you and do the test and send it in. We need to push those numbers up. Remember about the COVID Alert app. It might be up on your screen now. There it is. And flu shots. We're coming into flu season. We need everybody to get flu shots so that the hospitals don't get overwhelmed with a combination of flu and COVID-19. And then finally, if you need hospital care, make sure you avail yourself of it. The hospitals are telling me they're seeing a rise in acuity, and that's not a good thing. So we're going to get through this if we work together, follow the guidance, wash our hands, get tested, wear a face covering, and wear a face covering, particularly when you're in public. Thank you, and we'll see you next week.